Whether or not you should take a B-complex supplement depends on your individual health status, diet, and lifestyle. While many people can meet their B vitamin needs through a balanced diet, there are certain circumstances where supplementing with a B-complex can be beneficial or even necessary. These 8 water-soluble vitamins, B1, B2, B3, B5, B6, B7, B9, and B12, play critical roles in energy metabolism, nervous system function, red blood cell production, and hormone balance. Because the body cannot store most of them in significant amounts, consistent daily intake is important, and that's where supplements can sometimes help fill the gap. One of the clearest cases for a B-complex supplement is for those following a vegan or strict vegetarian diet. While plant-based foods provide many of the B vitamins, such as B1 in whole grains, B9 in leafy greens, and B7 in nuts and seeds, vitamin B12 is only found naturally in animal products. B12 deficiency can lead to fatigue, nerve damage, and cognitive decline over time if not addressed. Though fortified foods like nutritional yeast or plant-based milks help, they may not always provide sufficient amounts consistently, and absorption can vary. In such cases, a B-complex supplement containing methylcobalamin or cyanocobalamin, forms of B12, offers a reliable safeguard. Older adults are another group that may benefit. As we age, our ability to absorb certain B vitamins, particularly B12 and folate, can decline due to reduced stomach acid or gastrointestinal changes. This can lead to symptoms like fatigue, confusion, poor memory, or even anemia if not corrected. Some seniors also have reduced dietary intake or rely on medications that interfere with B vitamin metabolism, such as proton pump inhibitors, diuretics, or metformin. A B-complex supplement, especially one tailored for seniors, can help maintain cognitive health, energy levels, and overall resilience. Pregnant women have increased requirements for certain B vitamins, especially folate, B9, which is critical for fetal neural tube development and preventing serious birth defects. While folic acid is often taken separately, many prenatal vitamins include a broader range of B vitamins to support maternal energy and red blood cell production. B6, for example, has been shown to reduce nausea during pregnancy, and B12 is also crucial for fetal brain development. For women planning to conceive or in early pregnancy, taking a balanced B-complex as part of a prenatal plan is often recommended under medical guidance. People with absorption issues, including those with celiac disease, Crohn's disease, or a history of gastrointestinal surgery, may not absorb B vitamins efficiently from food alone. Alcohol use, long-term antibiotic use, or chronic stress can also deplete B vitamin stores or interfere with their utilization. In such cases, a high-quality B-complex supplement, ideally in activated or methylated forms like methylfolate or methylcobalamin, can support better absorption and reduce the burden on compromised metabolic pathways. Even people without obvious deficiencies might consider a B-complex supplement during times of increased physical or mental stress, when energy demands are high, or during recovery from illness. B vitamins are deeply involved in mitochondrial function, neurotransmitter synthesis, and immune regulation, all of which become more taxed during challenging periods. However, supplementation should not replace proper nutrition. A B-complex can help fill gaps, but it works best in conjunction with a diet rich in legumes, grains, seeds, dairy, eggs, and leafy greens. That said, taking a B-complex without need or without guidance can sometimes lead to unnecessary excess. Although B vitamins are water-soluble and generally safe, high doses, especially of niacin, B3, and B6, can cause unwanted effects. Niacin in large amounts can lead to skin flushing or liver stress, while chronic excess B6 may cause nerve tingling or numbness. It's also important to consider that some B-complex supplements use synthetic or non-bioavailable forms that may not be well tolerated by everyone. Choosing a well-balanced product with forms like methylfolate instead of folic acid and avoiding megadoses unless medically necessary is a prudent approach. Ultimately, the decision to take a B-complex should involve an honest look at your diet, health history, and lifestyle, ideally with input from a healthcare provider. Blood tests to assess levels of B12, folate, and sometimes B6 or homocysteine can provide helpful clues about underlying deficiencies. If supplementation is appropriate, It's best to take B-complex vitamins with food to improve absorption and reduce the risk of nausea. In short, a B-complex supplement can be a valuable tool in specific situations, especially for vegans, older adults, pregnant women, and those with absorption issues. But it's not a universal need. Like all supplements, it should be used strategically, with attention to quality and form, and always in the context of a nutrient-rich diet that provides the foundation for long-term health.